In this video, I'm going to provide a brief introduction to analytic epidemiological studies. Please make sure to read Chapter 7 of your textbook, which covers these study designs in detail. Analytic epidemiology is really important for the field of public health as well as society. We use analytic epidemiological studies for disease prevention, for the quantitative evaluation of interventions, so examining whether interventions were actually effective. We also use them for things like the safety and efficacy of drugs and medical procedures. So, for example, analytic epidemiology was used to study the safety of COVID-19 vaccines. In public health research, we are often trying to examine the relationship between some sort of exposure or exposures, some sort of risk factor with some sort of outcome or dependent variable. So, for example, you can think about, in terms of an independent variable and the relationship with a dependent variable. Examples could include things like the effect of physical activity on heart disease. What is the relationship between smoking and lung cancer? Does smoking cause lung cancer? These are the kinds of questions as public health professionals we are often trying to examine. So when we're thinking about how do we answer these questions, we use analytic studies. We're trying to explore causal relationships or associations between an exposure and an outcome. We have kind of two broad categories of analytic study designs. So we can look at things like observational designs. In this case, the investigator doesn't have control over the exposure of interest. So you can't decide who is going to have the exposure, who's not going to have the exposure. We're unable to assign subjects randomly to conditions. There is no control by the investigator over that exposure variable. One of the big challenges of not being able to randomly assign subjects into an exposure groups is the issue of confounding. So the people who are exposed might be very different from the people who are unexposed. So for example, if we're looking at breastfeeding as an example, you can't really randomize people into breastfeeding and look at their outcomes, right? So we typically rely on observational studies to look at the effects of breastfeeding. Well, at the end of the day, the individuals who choose to breastfeed, they might be fundamentally different in terms of the individuals who decide not to breastfeed. So we have this issue of non-equivalent groups, particularly the effect of confounding that is always a challenge in observational study designs. We also have experimental designs in which the investigator actually does have control who is exposed to a factor of interest. So for example, we have things like randomized controlled trials where we can actually randomly assign people into a treatment group versus a placebo group. We also have what we call quasi-experimental studies where we can, in a sense, control the exposure of individuals to a specific factor, but we are unable to randomly assign those people to study conditions. And we'll talk about that in a little more detail in a few slides.